Welcome to County Portal, your simple source for local government services and public records. Let's get started.
Today we're tackling a big question. What U.S. state has the highest percentage of its population enrolled in Medicaid? This is the joint federal and state program that provides health coverage to millions of low-income Americans, and how many people it covers varies dramatically depending on where you live. So, which state comes out on top? While the exact numbers can shift from year to year, the answer is consistently New Mexico. In the land of enchantment, it's estimated that about 1 in every 3 residents is covered by Medicaid. That's over 30% of the entire state's population, a figure that puts it at or near the very top of the list, often alongside the District of Columbia and Louisiana. So the natural next question is, why? There are 3 main reasons this is the case. First, and this is the biggest factor, is the Affordable Care Act, or ACA. The ACA allowed states to expand their Medicaid programs to cover nearly all low-income adults, not just specific groups like children or pregnant women. New Mexico was an early and enthusiastic adopter of this expansion, opening the floodgates for hundreds of thousands of previously uninsured adults to gain coverage starting in 2014. States that chose not to expand have far lower enrollment percentages. Second, you have to consider the state's economic profile. New Mexico has historically had one of the higher poverty rates in the country. Since Medicaid eligibility is tied directly to income, a larger share of the population naturally qualifies for the program based on their financial situation. The third reason is a proactive state policy. New Mexico has made a concerted effort to streamline the enrollment process and conduct outreach to ensure that eligible residents actually sign up and get the coverage they need. This combination of fully embracing a federal policy, having a population with a high level of need, and making it easy to enroll has created the perfect storm for a high Medicaid rate. This has a huge impact on the state. On the one hand, it means a massive portion of the population has access to healthcare, which improves public health outcomes and reduces the burden of uncompensated care on hospitals. It also brings billions of federal dollars into the state's economy, since the federal government pays for at least 90% of the cost for the expansion population. On the other hand, managing a program that serves a third of your citizens is a monumental administrative and budgetary challenge for the state. Ultimately, New Mexico's top ranking isn't a simple story. It's a reflection of policy choices, economic realities, and a commitment to getting its people covered. We hope this breakdown gives you a clearer picture of the situation. If you found this information useful, please hit the like button, as it really helps our channel grow. And for more deep dives into topics that affect our country, make sure you subscribe and turn on notifications so